Have you ever wondered what elimination disorder really entails? It's a term that might sound unfamiliar to many, yet it touches on a significant aspect of mental and physical health. It's a question many people might shy away from, but it addresses a sensitive and often misunderstood topic in mental health. Elimination disorders are more common than you might think, and understanding them is the first step towards compassion and effective support. Elimination disorders involve difficulties with bowel and bladder control, primarily affecting children. These challenges can manifest in various ways, such as bedwetting or soiling, and can be particularly stressful during developmental stages like toilet training. These disorders can be distressing for both the child and their family, affecting their emotional well-being, social interactions, and self-esteem. The impact extends beyond the physical symptoms, influencing the child's confidence and the family's dynamics. This essay will delve into the intricacies of elimination disorders, shedding light on their definitions, causes, symptoms, and treatment options. We'll explore how these disorders are diagnosed and the various therapeutic approaches available to manage them effectively. We'll use the DSM-5 TR criteria as a guide to understand these disorders better. This diagnostic tool helps clinicians identify and categorize the specific types of elimination disorders, providing a framework for treatment. We'll also explore a case study to illustrate these points in a relatable manner. By examining real-life scenarios, we can better appreciate the challenges faced by those dealing with elimination disorders and the strategies that can help. Remember, this information is for educational purposes and should not be substituted for professional medical advice. Each individual situation is unique, and a healthcare provider can offer personalized guidance. If you suspect you or someone you know might be struggling with an elimination disorder, seeking help from a qualified healthcare professional is crucial. Early intervention can make a significant difference in managing symptoms and improving quality of life. Elimination disorders are diagnosed based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, DSM-5 TR. This comprehensive manual is an essential tool for mental health professionals. This manual, published by the American Psychiatric Association, serves as a guide for mental health professionals in diagnosing and classifying mental disorders. It provides a standardized language and criteria for the diagnosis of mental health conditions, ensuring consistency and accuracy across the field. The DSM-5 TR categorizes elimination disorders into two primary types, enuresis and encopresis. These classifications help clinicians to identify and treat these conditions effectively. Enuresis refers to the repeated voiding of urine into inappropriate places, such as bedding or clothing. This can be a distressing condition for both the child and their family, often leading to social and emotional challenges. Encopresis, on the other hand, involves the repeated passage of feces into inappropriate places like clothing or the floor. This condition can also cause significant distress and may be associated with underlying medical or psychological issues. Both disorders are diagnosed when these behaviors occur voluntarily or involuntarily in a child at least 4 years old. It's important to note that these behaviors must be developmentally inappropriate for the child's age. The frequency of these episodes is crucial for diagnosis. They must occur at least twice a week for at least 3 consecutive months. This criterion helps to distinguish between occasional accidents and a more persistent disorder that requires intervention. Enuresis, commonly known as bedwetting, is more prevalent than many realize. It can manifest as nocturnal enuresis, bedwetting during sleep, or diurnal enuresis, wetting during the day. While occasional accidents are typical in young children, persistent bedwetting beyond a certain age can be a cause for concern. Nocturnal enuresis, the most common type, often involves the child having no memory of the event upon waking up. They may wet the bed several times a week or even every night. Diurnal enuresis, on the other hand, can be more embarrassing for the child, especially in social settings. It might involve a sudden urge to urinate without much warning, leading to accidents. Encopresis, while less common than enuresis, can be equally distressing for children and their families. It involves the repeated passing of feces in inappropriate places, even after the child has reached an age where bowel control is expected. This can manifest as soiling in underwear or even hiding soiled clothes. One crucial aspect to understand is that encopresis is rarely intentional. Children with encopresis might feel ashamed and embarrassed, leading them to hide their accidents from their parents. This secrecy can further complicate the situation, making it essential for parents and caregivers to approach the issue with sensitivity and understanding. Elimination disorders are complex and can stem from a combination of factors. In some cases, biological factors like genetics, delayed development of bladder control, or constipation might play a role. Psychological factors can also contribute significantly. Stressful life events such as a change in school, a move to a new home, or family conflicts can trigger or worsen elimination disorders. In some instances, underlying psychological conditions like anxiety or attention deficit/hyperactivity disorder, also known as ADHD, might also be associated with elimination disorders. Recognizing the signs of elimination disorders early on is vital for timely intervention. While occasional accidents are normal, persistent patterns of bedwetting or soiling beyond the expected age should raise concern. Apart from the primary symptoms of bedwetting and soiling, other behavioral changes might also indicate an elimination disorder. These can include withdrawing from social activities, avoiding sleepovers, displaying sudden changes in mood, or exhibiting signs of anxiety or low self-esteem. If you notice any of these signs in your child, it's essential to consult a healthcare professional for a thorough evaluation. Seeking help for an elimination disorder starts with a comprehensive assessment by a qualified healthcare professional. This process typically begins with a detailed medical history, including the child's developmental milestones, any past medical conditions, and family history of similar issues. A physical examination will likely be conducted to rule out any underlying medical conditions that might be contributing to the symptoms. The doctor might also recommend a psychological evaluation to assess the child's emotional well-being and identify any potential psychological factors contributing to the disorder. This evaluation might involve questionnaires, interviews, and observations of the child's behavior. Treating elimination disorders typically involves a multifaceted approach, addressing both the physical and emotional aspects of the condition. Treatment options may include behavioral therapy, medication, and lifestyle changes. Behavioral therapy often focuses on techniques like bladder training, reward systems, and managing constipation. Medications such as desmopressin for bedwetting might be prescribed in certain cases. Lifestyle changes such as adjusting fluid intake, establishing regular toilet routines, and incorporating high-fiber foods into the diet can also be beneficial. Let's consider the case of Emily, a bright and cheerful 7-year-old who has been struggling with nocturnal enuresis for the past year. This condition, commonly known as bedwetting, has been a source of distress for both Emily and her family. Despite consistent efforts from her parents to address the issue, Emily continues to wet the bed almost every night. They have tried various methods, from limiting her fluid intake before bedtime to waking her up in the middle of the night, but nothing seems to work. This persistent problem has started to take a toll on her self-esteem, making her anxious about sleepovers and social gatherings. Emily often feels embarrassed and isolated, fearing that her friends might find out about her condition. Emily's parents, deeply concerned about her well-being and emotional health, decide to consult a pediatrician. They hope to find a solution that will help their daughter regain her confidence and enjoy her childhood without the constant worry of bedwetting. After a thorough evaluation, the doctor reassures them that Emily's case is not uncommon and recommends a combination of behavioral therapy and medication. The pediatrician explains that with the right approach, many children overcome this condition successfully. Emily begins working with a therapist who specializes in enuresis, learning techniques like bladder training and relaxation exercises. These sessions are designed to help her gain better control over her bladder and reduce nighttime accidents. With time, patience, and consistent effort, Emily starts to see gradual improvements in her condition. Her confidence begins to grow as she experiences fewer incidents, and she starts to feel more comfortable participating in social activities and sleepovers. Elimination disorders can be challenging, but with the right support and understanding, children can overcome these challenges and lead fulfilling lives. Remember, these disorders are not a sign of weakness or a lack of parenting skills. It is crucial to approach children facing these challenges with empathy, patience, and encouragement. Open communication, positive reinforcement, and a supportive environment can go a long way in helping them regain control and build self-esteem. Remember that seeking professional help is essential for effective management and treatment. With the right approach, children with elimination disorders can thrive and lead happy and healthy lives.